Classification of penicillin drugs. Penicillins are one of the oldest and most widely used antibiotics, but did you know they're divided into groups based on their activity? Let's break down the types of penicillins and how they fight infections. Natural penicillins. The originals with strong gram-positive activity. Examples: penicillin G4 or IM, penicillin V oral. Spectrum of activity. Effective against gram-positive bacteria like Streptococcus spp. And some gram-negative cocci, examples, Neisseria meningitidis. Uses: streptococcal infections, syphilis caused by Treponema pallidum, and bacterial endocarditis. Notes: susceptible to beta-lactamase. Penicillinase-resistant penicillins, anti-staphylococcal penicillins, designed to resist staphylococcal beta-lactamase. Examples: nafcillin, oxacillin, dicloxacillin. Spectrum of activity. Narrow spectrum, effective against beta-lactamase-producing Staphylococcus aureus, not MRSA. Uses: skin and soft tissue infections, bone and joint infections, staphylococcal endocarditis. Notes: not effective against MRSA or gram-negative bacteria. Aminopenicillins. Extended spectrum for more gram-negative coverage. Examples: amoxicillin, ampicillin. Spectrum of activity. Broad, covers gram-positive bacteria and some gram-negative species like Escherichia coli, Haemophilus influenza, and Proteus mirabilis. Uses: respiratory tract infections, UTIs, otitis media, sinusitis, meningitis with ampicillin. Notes: often combined with beta-lactamase inhibitors for enhanced coverage. Examples: amoxicillin plus clavulanic acid. Beta-lactamase inhibitor combinations, combining penicillins with inhibitors to counter resistance. Examples: amoxicillin plus clavulanic acid augmentin, ampicillin plus sulbactam, piperacillin plus tazobactam. Spectrum of activity. Enhanced activity against beta-lactamase-producing bacteria. Uses: polymicrobial infections, intra-abdominal infections, respiratory tract infections, and hospital-acquired infections. Notes: widely used in resistant infections. Extended spectrum penicillins, anti-pseudomonal penicillins, targeting tough gram-negative bacteria. Examples: piperacillin, ticarcillin. Spectrum of activity. Broad spectrum including Pseudomonas aeruginosa and other gram-negative organisms. Uses: severe hospital-acquired infections like pneumonia, sepsis, and intra-abdominal infections. Notes: often used in combination with beta-lactamase inhibitors. Examples: piperacillin plus tazobactam. Penicillins with specific uses. Specialized formulations for specific infections. Procaine penicillin. Long-acting IM injection for syphilis and streptococcal infections. Benzathine penicillin. Very long-acting IM form used for syphilis, rheumatic fever prophylaxis. Conclusion: penicillins are a cornerstone of antibiotic therapy with a wide range of applications. From natural forms to advanced combinations, their versatility makes them invaluable in treating bacterial infections. Always consult your healthcare provider for the right antibiotic choice.